Investing should be easy, right? For most people, though, the process of investing can be daunting, and savvy investing, impossible. Here at Alliant Retirement and Investment Services, we don't think it should be that way. So we asked two of our financial consultants, Christian Chapluha and Tom Davia, to share their advice with you. They're here to walk us through the fundamentals of investing so we can make informed and better decisions with our money and what we need to do to prepare for the road ahead.
Welcome, everyone, to episode number 9 of our Invest Savvy podcast. I'm your host, Tom Davia, and today we're joined by a special guest, Joanne Giardini of the Giardini Medicare Transition Team, which is an independent provider of Medicare products nationally. Joanne and her team specialize in the transition to Medicare from the workplace. And as there's more than 54 million Americans eligible for Medicare, today's conversation will be an overview of what is Medicare, do I need it, how much does it cost, and some common mistakes. So Joanne, I know I've shared this story with you before, but one of my clients, who is now a mutual client of both of ours, was told at her last doctor's visit that she was the most excited person they have ever talked to about insurance coverage and Medicare. So Joanne, thank you for joining me today. And please tell us a little bit about yourself, your company, how you got started, and how could somebody possibly be excited about their Medicare coverage?
Thanks, Tom. Thanks for having me here. So yeah, we actually live in Medicare land. So it's kind of our day, 24/7. So that's always funny to hear comments like that. I have an agency here in Michigan, and we have 10 people that, again, live and breathe kind of Medicare only. That's all we do. So you start to get pretty good with Medicare. So we really help people transition into the Medicare system for the first time. There's so much chaos and confusion and stress related to the event of turning 65 or when you're starting Medicare. People just don't know what to do and where to go. There's a lot that goes into Medicare planning, which is why you talk about it in your practice and the webinars that you and I do together, because it really is a really important piece of people's worlds, and they're looking for ways to learn. So hopefully this will deliver on some of that information today.
Okay, so to get started, can we talk a little bit about what is Medicare and the difference between your firm and a financial advisor?
Medicare really is just health insurance. So what's very different first and foremost with the financial planner, like in your role, you're not telling people and suggesting what health insurance packages that they should get. Now, if we do that as my agency, they're going to come back to Tom and say, hey, Tom, I'm paying X amount of dollars and working it into their financial plan. So that's not what we do. But what we're doing is delivering the person the healthcare package that they need with Medicare as they go into retirement. Medicare has different components. It's got partial government interaction. So you've got 80% of your coverage is typically coming from the government side. And so we're walking people through the whole interfacing with Social Security Administration and with Medicare.gov and things like that in order to set up the foundation of their coverages. When they get that piece in place, we're really working with the client to come and say, there's Medigap, there's Medicare Advantage, there's drug plans, there's standalone dental plans, and then putting those packages together for people. Our job is to help them to understand what they're buying, some of the pitfalls that kind of go into the purchase, because there is a lot there. Then they're bringing that total number back to Tom and saying, okay, Tom, I got this, this, and this. Work with me on my financials. So luckily, we live in 2 different spaces.
You mentioned understand better what they're buying. Big question always comes up is, do I need it? Do I need Medicare?
Yes. So that is even backed up prior to even talking about the coverages and the policy types and things like that. When people turn 65, and this is our most often asked question, it's always, hey, I'm turning 65 in October, but I'm still working. Do I have to go to Medicare? It's multifaceted, but the answer to that one is going to be no, you don't have to go to Medicare, but there's a lot of little spin-off questions. If there's 20 employees or less at the workplace, then you do have to go to Medicare. People don't understand that they don't necessarily have to go to Medicare at 65 years old. So a lot of people these days don't. They're working longer. They have coverage elsewhere. So we can help them upfront answer that question too, because that's your most important starting point is, do I need to get it? If you do, by all means, find a good agent and go get it all set up. But if you don't need it, don't hurt yourself financially and making different choices that are actually mistakes that you're not aware of yet. But don't just go sign up because you're scared into signing up. That's just something really, really important to get across to people is don't do it just because. All right. Always know your reason why you're enrolling into the Medicare system.
Right. And maybe one of those reasons, pre-existing conditions, would that be something we talk about in Do I Need It?
It can be. Sometimes people will literally just enroll into Medicare and Medicare products because maybe the coverage is better. Maybe they are handling a cancer episode and it's very serious and they want to go to a certain specialist and maybe their current insurance isn't covering it adequately. There's reasons like that to go get Medicare. With regard to pre-existing conditions, people really need to understand how Medicare treats pre-existing conditions versus group insurance or marketplace, things like that. Another really big misconception people have is that when they enter their Medicare years, they do believe that it's a lot like the Obamacare or ACA carryover, meaning that they have protection from pre-existing conditions, and they do not. If you have pre-existing conditions and you're concerned about that, please be sure you're getting with somebody that knows Medicare, because you can really hurt yourself by doing things wrong at the wrong time. There's a lot of little rules and things you have to do at the right time with Medicare. So if you can take away from today, this is not the ACA. Pre-existing conditions can affect you in the Medicare years. With a trigger, the little antennas go up for you to pay more attention.
We're trying to give an overview today, so we don't have a lot of time to go in depth in every topic.
Right.
But each question I ask you, I think to myself, this could take a while. There's a lot of information here. So the next one that we wanted to talk about is, how much does it cost? And I know that's a big question. I don't know if you could kind of throw in there too, maybe a difference between a Medigap and a Medicare Advantage plan.
So Medicare costs, a lot of people, they think there's no cost or it's really highly subsidized compared to when they get here on our doorstep. They're like, oh my gosh, I can't believe it's this expensive. So be prepared a little for some sticker shock, perhaps. The base rate to Medicare today in 2022 is $170.10, and that is per person per month. There are also 6 tiers to the pricing system. The top tier, and this is if you're over $750,000 for a joint income, which maybe this doesn't include many of you, but if it does, your rate will be $578 per person per month. So you can see that's pretty significant. People that are in some of these different categories, they come in just shocked at what they're going to pay. That's just to the government. So that piece that I just talked about, the base rate of 170 all the way up to 578, that's just the component with the government. That's part A and part B. On top of that, you're typically going to work with an agent to get a supplement, which is a Medigap contract. That can be about $130 or $140 a month per person per month. And then they also need a drug plan. Who knows? That could be $10, $20, $30. It depends on your medications, things like that. So you can see the costs are adding up. Medicare Advantage, on the flip side, if you go that path to Medicare, they are often zero premium. So those are the things you see on TV advertised for zero premium. They've got some dental, things like that. They are definitely 2 separate, totally different apples and oranges lands. So you need to understand how they differ and why you would get something for zero versus paying the $120 a month. That is the total kind of pricing packages. So hopefully that helps gauge some of you with your budget.
And I would mention too, when you talked about some of those prices being between $170 a month and $578, a lot of that is going to be part B and based on total household income or adjusted gross income.
Modified adjusted gross income, correct.
Right. So again, a plug for some of our financial planning services as well. Having a financial plan put together and looking at income in the future, which also will include required minimum distributions. Be surprised over time what the compounding power of a investment account does and how much the government wants you to take out. So that's something that we can help plan too, to make sure that those costs stay in check. Another question that we wanted to talk about today is common mistakes.
Yeah. And actually this mistake was just made about an hour ago before I got on this podcast. One of our clients emailed and she had a drug plan that in March expired. She just messed up her banking mechanism and she didn't call her agent. She called the insurance company directly. So what they did was they put her in a Medicare Advantage plan. She has no idea what she has done. Her last line of the email was, did I make a mistake by doing this? And she sure did. Number one, if I could just encourage everyone, when you're ready for Medicare, please be sure that you have an agent that knows Medicare and can handle some of those things for you. If you go it alone, you will make a lot of mistakes. You'll have a lot of questions. You won't have any place to turn. So number one is not having an agent or a guide or a Sherpa along that whole trek into Medicare. Number two, I would say, is not understanding that pre-existing conditions, they do present a really big problem. If you have a pre-existing condition and you choose the wrong policy type out the gate, and then 5 years later have a big issue, there's no going back. Many, many times there is no going back. So it's not fixable, some of these things that you're making mistakes with. Another mistake is not preparing for the IRMA with people like you, Tom, not coming in and talking through the income streams and trying to manage those, because that's what Tom does with you. That's not what we do. We can't fix your income streams when you hit Medicare. And because you didn't know these things doesn't mean that you're going to get out of these kind of things. Another thing I would say, because we're right around the corner actually from the annual election time, people that have a standalone prescription drug plan, the carriers send all the documents out to you telling you what your plan is going to change to. Maybe your premium is going to double. Maybe your drug is no longer covered. Maybe your CVS isn't covered as a pharmacy any longer. Things like that. They're going to send you all those changes. A lot of you, 80, 90% of you do not change those plans. You don't even look at the materials in September. And a lot of you just don't pay attention. And so guess what? In January, when those plans technically renew, that's when you're going to see the changes. And then it's too late. You can't change your plan. You may have lost $1,000. We see people making just gobs of dollars of mistakes by not looking at their Part D plans every year. So those are the big things, really, not understanding what you're getting, understand whether you should enroll or not enroll at the basic, shop your drug plans and use a good agent that you can bounce your ideas off of versus calling the carriers directly. So those are probably the biggest things that we see consistently, people making mistakes.
Okay, so you mentioned two things there. One, the annual election time, and number two, use a good agent.
Right.
I think we're getting up into that time that we'll see a lot of celebrities on TV, maybe Joe Namath, different celebrities will talk about certain plans. Can you just talk about that a little bit, the difference between what you guys do, your firm, and what people see on TV?
What they're seeing on TV when Joe Namath is coming on, Joe is paid lots and lots of money by these call centers, essentially. And he is doing a great job because he's getting people to ring that phone line. He's advertising for lots of things saying, if you call, you're going to get money back on your Social Security. You're going to get free transportation. You're going to get free food, everything for free. Now, just understand that he is targeting primarily Medicaid and Medicare recipients that are eligible for two programs. So a lot of the universe that are listening to these commercials, they don't even qualify. But if they can get you to call, they will do a very good job of trying to change your coverage and put you into a Medicare Advantage plan. I'm not saying that these plans are bad. I'm just saying people have to understand their plan. It is very stacked against you as a consumer. I will say that even this year, CMS has come out with new guidelines for agents because this has gotten to be such a problem over the last couple of years. They are actually requiring that we record every single call, every contact we have with any client of ours about anything. We have to keep the recordings for 10 years because so many people called Medicare to complain the last couple of years. That should tell you right there, it's probably not a good idea to be calling these commercials, but they're still going to be on TV this fall. Really buyer beware, be very careful. That's why it's good to have an agent. It doesn't even have to be us, just call an agent where you can just say, hey, hey, Tom, this is on TV. What are they talking about? Why are they asking for this? Or why is this company calling me? Why are these agents bugging me? There's a lot of money to be made in the Medicare space and especially Medicare Advantage.
Yeah. And I think to that point, in summary, right, all Medicare plans are not one size fit all.
No.
And your doctor might not take all those celebrity endorsed plans.
Correct.
So with that said, we tried to cover a good amount of information here. What are next steps, or what should people do before calling Giardini?
Before you start with any agent, if you'd want, you can interview a couple, including us. We have a website called mymedicarestuff.com. Very simple, mymedicarestuff.com. And on there, you'll see links to our podcast, our YouTube channel, our TikTok. So I would really advocate trying to learn in a private little setting where you're not relying on putting your phone number in a website or calling somebody and getting a whole bunch of phone calls back. 64 and a half years old, poke your head out, learn a little, see who you're comfortable with, what you're comfortable with, what kind of product you're comfortable with, and then start there. Start interviewing some agents and just getting your path there and getting somebody you're comfortable. Some people want a local agent. We are totally virtual and over the phone. And if you don't have an email and you're not into technology, then we're not a good fit for you. There's a good fit out there for you. Take your time. Don't get pressured into some of these things. Take off little bite sizes so you understand what you're buying. That's the key to Medicare, is understand what you're doing.
And you mentioned also working with a local agent. So at Alliant Credit Union, right, we're all across the country. Is there certain states that you don't cover?
We cover about a dozen states, but we do have referral partners in every single state. So it's been quite an expansive referral network. We choose agents that are like us. Agencies our size is similar across the country. We know them very well. So we trust them to do a good job. So we do refer out quite a few people every month as well, but we work in about a dozen states.
Good. And I didn't mention in the beginning, but your firm and Alliant Credit Union, we're not associated, we're not related. There's no compensation that passes between us. I
Correct.
think that you're just a great organization to work with. We've had a lot of success stories with our clients, like I shared in the beginning. So just want to let everybody know that's not an affiliation of the credit union here.
Correct. Right.
With that, Joanne, usually what we do is we wrap up our podcast because our podcast is called Invest Savvy. We
Mhm.
wrap it up with a savvy piece of investment advice. So I'm not going to put you on the spot and ask for your advice today. I'm going to share my advice. My advice today for this topic is worry less. And when I say worry less, what I mean is you now have access to Joanne and her team to help you with your transition to Medicare. You have access to myself and our investment team here at Alliant Retirement and Investment Services. So let us help you. Let us help you take the first step to creating your financial plans and worry less. Joanne, thank you for your time today. Thanks for sharing that. I know there's a lot more that we could talk about, but just kind of a taste of what's out there and what we can offer both on your firm and our firm. So appreciate your time.
Likewise.
Thanks so much. Joanne mentioned her website and all the resources there. So I wanted to share that with you. You can find that at mymedicarestuff.com and definitely follow her on TikTok as she's got some great stuff out there. You can find new episodes of Invest Savvy on Apple and Google Podcasts and all major platforms or on our website. We invite you to follow us on Facebook and LinkedIn for new episodes and educational webinars and articles. Just search ARIS, ARIS.Alliant to like and follow.
Thank you for listening to Invest Savvy, advice you need to know. To learn more about our hosts, Kristen Chupluha and Tom Davia, and the team at Alliant Retirement and Investment Services, please visit our website at aris.alliantcreditunion.com. If you have questions for our hosts, you can submit them through our website or email investment-services@alliantcreditunion.com. Kristen Chupluha and Thomas Davia are registered representatives with, and securities and advisory services are offered through LPL Financial, a registered investment advisor and broker-dealer. Member FINRA SIPC, SIPC. Insurance products are offered through LPL or its licensed affiliates. Alliant Credit Union and Alliant Retirement and Investment Services, ARIS, are not registered as a broker-dealer or investment advisor. Registered representatives of LPL offer products and services using ARIS and may also be employees of Alliant Credit Union. These products and services are being offered through LPL or its affiliates, which are separate entities from and not affiliates of Alliant Credit Union or ARIS. Securities and insurance offered through LPL or its affiliates are not insured by NCUA or any other government agency, not credit union guaranteed, not credit union deposits or obligations, may lose value. The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision. Investing involves risk, including the potential loss of principal. No investment strategy can guarantee a profit or protect against loss. Neither LPL Financial nor its registered representatives offer tax or legal advice. Always consult a qualified tax advisor for information as to how taxes may affect your particular situation.